Assalamu alaikum. Welcome to the Progeny podcast. My guest today is Dr. Safa Nahar, who has been working as a dentist for the last 8 years in a family-run practice alongside her father and sister. Today we will be discussing dentistry and the modern methods used by dentists. We'll look at the rise of social media and its positives plus negatives, the role of Muslim women in the workplace, plus Dr. Safa's role as a mother and wife. Dr. Safa, thank you for joining us.
Thank you for having me.
I always feel nervous when I come to the dentist for some reason. Not recently. Maybe today you're on the other side,
Yes,
feeling nervous doing this interview.
Yeah.
Thank you for coming. I know
Thank you
Thank
you for asking me.
We've been trying to book this interview for quite some time, but dentists are very difficult to get hold of. But thank you for coming.
Thank you.
The practice you work at are specialists when it comes to nervous patients.
Yes.
And this is something that is only present at your sort of clinic, from what I know.
Yeah, so there are lots of clinics that specialize in treating nervous patients, but we have a unique way of doing this. And our way is called the enjoyable dentistry technique.
Mm-hmm.
And it is something that was created by our principal, who's my father, during his master's degree in clinical hypnosis applied to dentistry. And it's really a way of, it does what it says basically on the label. You enjoy your treatment from beginning to end.
Mm-hmm.
And the way that we do that is we use a mixture of relaxing air, happy air, and also some guided meditation. And it allows our patients to feel so relaxed that they really don't care what's happening during the appointment. So, we do all sorts of treatments. We do normal general dentistry, extractions, fillings, but we also do implants. We do a lot of smile design and things like that. So all of these appointments can be quite long, and they do involve injections, local anesthetic. Our patients don't feel it. They have such a great experience, and by the time they come round, they're like, it feels like half an hour when it's normally been 2 to 3 hours. And
wow.
Yeah. So it's something that we know the value of. We love providing it to our patients, and we don't, it's complimentary. We don't even charge for it, but we do that because why should anybody hate going to the dentist or not enjoy their treatment at the dentist, or be afraid of their treatment? It's something that we value very much as a practice. So that's, we're very lucky to have won awards for it as well. We've won best treatment for nervous patients for 3 years in a row. This is nationwide. Mm-hmm. So we're, it's really nice to be recognized for that. And you just need to speak to our patients, to be honest. They love it.
Your father has been, practicing for a long time.
Yeah.
We, as a family, we've been patients for quite a long time as well, from my grandfather. So this is the third generation at the clinic. How much of an influence did he have on you becoming a dentist? And how much of an influence does he have on you today?
That's a really good question. Obviously, he had a massive influence on me becoming a dentist. I always say, I knew I wanted to be a dentist from 8 years old.
Okay.
So what 8-year-old knows that they want to be a dentist?
Okay.
He definitely brainwashed us.
Did you use that gas on you?
Probably. To be honest, yes. But, I'm very, very grateful that he encouraged us, and he made us see that actually it's such a caring profession. It is very artistic. You get to use your hands a lot. You get to meet patients, build really nice relationships with your patients. Whereas medicine is so caring and it's so lovely, but I think it's just becoming much more difficult nowadays.
Mm-hmm.
So, or he used the gas. I don't know, because my sister's in the business and my brother is studying to be a dentist as well. So we are very much invested in the vision, and it is all down to our dad, to be honest.
We were talking about how dentistry's changed.
Yeah.
Everyone nowadays, and I've discussed this with a lot of people, look to create or take the perfect selfie.
Mm-hmm. Yeah.
That's one thing I say when I speak to people. I say, imagine how many times they had to take that photo for it to come out this good and for it to come on Instagram, because you know, I'm sure they've tried different shots and different lighting and different angles, and then now what's added to that is the smile. And like we said, you know, before people might go to the dentist because they're in pain. Now people go to actually have the perfect smile. I'm sure you get a lot of those patients that actually come and literally say, I want the perfect smile.
Yeah, absolutely.
How do you give them the perfect smile? What is the perfect smile?
Wow. Okay. So that's a very big question. The perfect smile, in my opinion, and it's by my humble opinion, is a smile that you can be confident with, that allows you to smile and allows you to be, you know, the best version of yourself. Because you have nothing holding you back. You're not afraid. You're not embarrassed. You know, you're not self-conscious. That, in my opinion, is the best smile. Now, how you achieve that? Yes, we have principles that we work towards as dentists. You know, which has been researched for thousands of years. For, you know, 4,000 years, people have been studying beauty and proportions in the smile. So that's something that we can learn. But how it looks according to each individual person, there are variations and it can be different. So, you know, we follow general guidelines, but we very much listen to the patient and we ask them, you know, what would you like to see? What bothers you? My first question to my patient is, I hand them the mirror and I say, what bothers you? Because I can point out lots of flaws, but if the patient doesn't see them or is doesn't bothered by them, then who am I to say anything? So they have to show me exactly. It's up to them. So that, in my opinion, and yes, I mean, I'm not a selfie expert at all. I hate taking photographs, but I think, and there are filters and things you can get now as well. But, you know, I think it's really not about how you look on camera. I think it's about how you carry yourself in day-to-day life, how you feel about yourself in day-to-day life. And that is, I guess, if I was to put a message out there, I'd say, this is what is more important, in my opinion, and this is what will make you happier in the long term. It's not just about quick fixes, you know, teeth whitening strips, things like that. You know, quick veneers when you don't need them, when your teeth are crowded. There are lots of ways that we can get the perfect smile, and the best way is to go and speak to your dentist.
The rise of social media, how has that helped with your profession?
I think it's helped in a lot of ways. Firstly, like you said, people are more concerned with how they look. And that helps in that people become more aware of issues and kind of, they become more in tune with themselves. I'm not happy with my smile. I need to sort it out. And so they can come and see a dentist. And that leads me on to the fact that we can now advertise essentially for free on social media about our services and what we do, and people are interested and people will come and find us. So that's great also. We found that as a practice, we're able to put across our message very easily on social media. You know, people contact us all the time and they say, oh, we love how the feel of your practice, how everyone's so friendly and you're such a good team and all of that. And that's all through social media. So that's really nice for us. And also people are becoming more clued up, they're more aware. They know about treatments that are happening out there, about, you know, the types of teeth whitening. You know, I have patients that come to me say, I want this. They're basically just given themselves a treatment plan, which is great because they understand what they want. But then it's my job to, you know, fill in the gaps for them and give them the full picture.
I've read the reviews, well, not all of them, but I've read the reviews that are available online. You've got really good reviews. It seems like everything's perfectly going at the care dental practice. Is there times where things do go wrong, and like how do they go wrong? Because, you know, when I'm there, or you think that everything, or when people see your social media, they think everything's running smoothly. What are the challenges and the problems that you face day to day? Yeah,
so I mean, this is my problem with social media, because you only portray what you want people to see, right? You don't portray the bad times or the challenges, and that is with all social media. So there is a smokescreen 100%, because you can't get to a level where, you know, you have 300 positive reviews without a lot of hard work. And the challenges, I guess, firstly, is that, I mean, it's the biggest blessing that we're a family business. So my sister is the business development manager. My father is the principal, obviously. I'm the clinical lead. And our mother is our biggest support. And my brother is studying to become a dentist. So that's great that we can we meet challenges, or disagreements. If we have disagreements, we'll just have it out and then we'll move on. That's fine, because we're family. We're not going to, make a big deal about it. But on the other hand, family dinners, Sunday lunches, holidays is all business. It's just business talk. And so it can take over your life a little bit. So that is one challenge. But also, I guess, just trying to keep up, like you say, with the whole social media. We're very particular about our patient journey. We still feel like we're always working on trying to achieve the best journey for our patients and the best experience possible. And, there are issues with staffing and training and just all the normal issues that dental practices and businesses face. But it goes on behind closed doors, so nobody knows about it.
Some people think dentists overcharge their patients.
Yeah.
But, I know that, for example, dentistry is an ongoing sort of career where you're always studying new things. I've noticed that you're always at new courses, events where there's new research happening. So you're always learning as you go. It's not sort of you do the degree and then that's it, you're a dentist.
No.
But, why do people think that it's overcharged?
I mean, to be honest, I think you said this to me before we started and I was very surprised that I haven't heard it. But I can see why. I can definitely see why. Because I think we often get compared to the doctors, for example.
Yeah.
And, medicine in this country, I have, my husband's a doctor, but not only that, a lot of my friends and colleagues are doctors, and what they do is incredible. And they are undervalued in this country, and it's not fair. And that comparison, I think, is kind of negative in terms of how it looks on dentists. But like you said, we are constantly spending money on our education if we want to be good and if we want to be outstanding in what we do. So it's constant courses. I mean, there hasn't been a year, like I'll tell you, this is funny. My husband made me sign a contract to say I will not do any more courses this year because I've done about 10.
Wow.
Yeah. And just because it was taking up too much time but you have this constant hunger to make yourself better and give the best treatment you can for your patients. But not only that, we've studied for a long time, and the work is backbreaking. It is physically backbreaking. And the stress from patients, I don't want to make it sound, I love my job. I love what I do. I don't want to make it sound...
I wouldn't like being a dentist because I'd have to look at down people's mouths.
That's what everyone says.
I mean, how do you find that?
It's great.
Really?
I love teeth.
Okay.
Yeah.
So a lot of people actually say that, I can't,
lots of people. I mean, that's the biggest thing. Like, how are you a dentist? How do you look at people's mouths every day? If you become specialized in something, it becomes your passion. So yeah, it's great.
Dentistry's evolved with the cosmetic sides of things. Now you can go to a dentist and get Botox.
Yes.
How's that changed dentistry, and when did that start? Is that recent? Or is that something that came from the US?
Yeah, I mean, most companies, most of the brands of Botox and fillers and things like that. So, they are made in the US. But I think it's it was a global thing that happened, I think around, I can't be sure about the dates, but, probably around 25 years ago. People are always trying to come up with new ways.
How long have you been a dentist for?
I've been a dentist for 8 years.
8 years, okay.
Yeah, so before me.
Okay, so you also do the cosmetic side?
I do both. I carry out Botox, anti-wrinkle injections and fillers, dermal fillers, and I can prescribe medical grade pharmaceuticals and creams, and also chemical peels. Basically, I've trained in quite a few aesthetic procedures, and I really like it. And for me, it's not so much changing the way somebody looks, or I hate the overboard, and I think that everybody's moving away from that, from that kind of look of being done. It has to look natural, and for me, the purpose is, again, if it makes you feel better, why not?
Someone might be watching or hearing us, listening to us, and I've heard this before as well. That's why I'm bringing it up and saying, this is all fake. Everyone's now looking for this, perfect selfie they want to take.
Yeah,
And there's obviously, I can see that there's dangers to this as well, where
absolutely,
you're like you said, you mentioned nicely that the dangers of social media is that you only show what you want people to see, and there's other things that you hide. Not that people hide things, but when it comes to the rise of mental health issues today, the rise of depression and both men and women, and with the rise of social media, there's dangers in portraying something that's fake, but living a different life. But what you're doing is, especially if you're a celebrity and you have a following, is you're getting other people follow this trend which you're portraying. How do you feel about that one?
I mean, a lot of people say, come and say, I want this celebrity's lips, or this celebrity's nose, or whatever. And it's our job as responsible practitioners to kind of unpack that. Why do you want it? If people we are constantly screening for mental health problems, whether it's dentistry or whether it's aesthetic. We're not experts, so we can't, but you can get a feel of it. Body dysmorphia is a very real thing. If somebody says, my nose is too big and it's not, then it is to them, that's fine, but they need a different kind of treatment. They don't need you to, give in to their need at that moment. Straight away, and I would probably refer to a specialist or, an expert in this. So it's a very real danger. We have to be aware of it. Any responsible practitioner needs to be aware of it, needs to have it in their consultation. But, on the flip side, if somebody says, I've hated this bump in my nose for years, is there something you can do about it? And I can do something about it, then and it will make them feel like $1 million, then that is something which I think is really nice to be able to provide. And I like to go one step further, and I like to assess everything, including the mouth, including the teeth, because doctors are some of the most amazing aesthetic practitioners, but they don't have the knowledge of what you can do with your teeth as well to improve the overall face, because your teeth sit in your mouth, which is part of your face. So it has to be a whole picture. And the same with nurses and other practitioners. As dentists, we're in a unique position where we can actually assess everything and we can offer them that kind of thing. So obviously not all dentists are aesthetic practitioners, but if you are, then you can use it to your advantage, I think.
Coming back to this perfect smile, what's the newest sort of technique now to get, obviously I'm guessing the perfect smile has to have white teeth, straight teeth.
You've got it actually. There's 3 components to a nice smile nowadays: straight teeth, white teeth, and teeth that are nicely shaped, that are even, symmetrical.
What about the lips?
Lips, lips, I personally think, yes, lips contribute to it. But that's in terms of dentistry, because, like I said, not all dentists are aesthetic practitioners. That's not something that we really can do much about. We need to take note of it. We need to be careful, because the position of your teeth can affect the position of your lips.
Okay.
But again,
and the newest technique for those 3 components?
Well, for example, straightening your teeth. A lot of people are doing teeth straightening with Invisalign. That's something that I am very
similar to the braces
about. Yeah, so it's similar to braces. They're clear braces. They're completely clear, and you wear them, basically they're removable as well, so you wear them for most of the day, about 22 hours of the day, and they eventually straighten your teeth because you change them every week, so they put your teeth in the right place. Now, something like Invisalign, which is probably the most common type of clear brace, has about £100 million worth of research pumped into it every year.
Oh.
So it's something that works. It is completely digital, and people prefer this to traditional braces because obviously because of how it looks, but also it's easier to clean your teeth. It's more predictable. So a lot of people are doing this because it's kind of, it fits into their lifestyle, and it's all about lifestyle nowadays. And then the teeth whitening is teeth whitening. You know, it's something that is not allowed to be done by beauticians anymore. It has to be done by a dentist. So again, that's something that has its dangers, but it's quite a straightforward treatment to do. You know, there are things, and then also to change the shape of your teeth, there are things that you can do. For example, composite bonding. That's something that's very popular, and that is basically white filling, which is perfectly matched to your teeth, and either the dentist will sculpt it to give you the result that you want. So if you have like worn edges, sharp edges, you can create the look that you want. And you do that very easily, very quickly in one appointment, no drilling, and, you know, essentially no pain or anything. If you want to go further, veneers are an option as well. Veneers are very, very thin covering of the tooth. It just covers the front of the tooth, and it's made out of porcelain. Sometimes we need to file the teeth very, very gently for that, to create enough space for it. But again, it's very nice, very predictable. You can get exactly the look that you want. And what more and more dentists are working towards is trying to get the perfect smile in a mock-up first before they go ahead and put the porcelain on. So, you know, techniques are moving on. And again, this is why we have to keep up with everything. But there are really nice ways of being able to create the look that a patient wants really easily.
I want to move on to something quite important,
Sure.
and that's Islam. You know, there's nowhere that says, you know, women shouldn't work. And Islam, whenever it speaks about men or women, it addresses them equally. Al-mu'minina wal-mu'minat, believers, men and the believing women. The fasting men and the fasting women, the praying men and the praying women. So it's always addressing them equally.
Yep,
when it speaks about men and women in the Quran, their roles may differ.
Yeah.
Which is
yes,
something.
I agree that the roles can differ. I don't feel like they have. I mean, obviously, biologically, nobody can change that.
Yeah,
you know,
of course.
A woman
Yeah.
has to be pregnant and give birth.
The role of motherhood, for example.
The role of motherhood is, you can't change that, and that is, you know.
That's what I meant when they're different.
Yeah, exactly. But for example, we have the example of Khadija, the Prophet's wife.
Being a businesswoman.
She was incredible. She was the most amazing, and in the most difficult time.
Correct.
Where they used to bury their daughters when they were born.
Correct.
So, you know, I really look up to figures like Khadija, for example, that we have in Islam, that, you know, it's okay to not fall into the old stereotypes.
It's amazing that you say you look up to someone like Khadija, and this is sometimes and I've been questioned this, that Muslim women don't have enough role models.
Yeah.
And that's why we'll have to have Kim Kardashian as our role model, for example.
Yeah.
But you know, they forget the simple, you know, not simple, but the beautiful story of the Prophet of the wife. Yeah, you know, even the whole marriage, how it happened, the fact that she was one of the wealthiest women during the time when women used to be oppressed in a way where if someone gave birth to a female, then they'd bury her.
Exactly.
You know, and the example of the daughter of the Prophet, and when you think about this is the best of mankind in Islam, the Prophet, and Allah grants him the one daughter where his progeny continues.
Exactly.
So that tells you something, I think, with regards to how Islam respects women. I always say, don't look at Muslims in the way they treat women, because don't look at certain countries or states where only recently in some countries they allowed women to drive or to vote and say this is Islam. You know, these are people that are Muslims. Exactly. It doesn't mean they represent Islam, whereas Islam is more. And again, it goes back to how we look at Islam and how we define are, and then we've sort of made our own religions, according to the
exactly.
way we think, according to our culture, our traditions.
Culture and tradition, unfortunately, I think gets really mixed in with
Sometimes the good things.
Religion. Yeah, exactly, absolutely. And I think actually there's probably lots and lots more role models in Islam, of women, but they just haven't been documented. They haven't been reported on. There's no stories about women because it's always been men that tells the stories, or men that were educated in that time.
Interesting.
And so that's really unfortunate. And actually, to your listeners, if anybody has an interest in this, please get in contact with me, because I'm so interested in it. Honestly, it's really important.
You mentioned something important, that you're also a mother, and a wife.
Yes.
And you're working, and you said just this year you went to 10 different courses.
Yeah.
How do you sort of balance, being a mother, a wife, and working, and the fact that another difficult part of your job, it's also a fun part, I'm sure, is working with your family. But what happens is when you're at a lunch on a Sunday, you end up talking about work. When you're on holiday, you're talking about work.
Yeah.
How do you balance that?
It's very difficult. I don't know if I've got the right balance, to be honest. I feel like I'm in a good position, but I don't know. I mean, you have to, organization is the biggest thing, I guess. You have to organize your life. You have to, I'm constantly thinking about whether I've given one part enough attention and enough of my time. I call it mum guilt. Mum guilt is always there.
Okay.
When you go to work, you feel guilty. When you come back home, if you're doing housework, you feel guilty. It's even if you're spending time with them, you have to push that feeling of guilt aside, because you're there with them. You just need to learn to appreciate it more. So that's a very real thing. And I'm sure it's the same for fathers. I'm sure that they feel that also. But I think because of the years and years of conditioning that, you're a mom, you should stay home, you should be there for your children, you should do that. It's difficult to kind of break away from that. But at the same time, I think it's important for my children to see that I work, that I achieve, that I'm a person in my own right. I'm not just their mother. I have a lot to offer society, and I have a lot to offer my workplace, just like any other person. So that's the way that I see it personally.
You mentioned father, but I'm gonna come back to that.
Yeah.
Do you think the role of, like, the father's, I'm not saying that the father's job should be go out to work and the mother should be at home.
Yeah.
Not at all. No.
Yeah.
But a mother's lap, and I'm just trying to see where you are on the side. Yeah. A mother's lap is very difficult to be replaced.
Yeah.
Would you agree?
I do agree.
Because, I always think that the primary role of a woman when she goes is to sort of be there.
Yeah.
But of course, I'm not saying she shouldn't go out to work. But
that's
why I spoke about the balancing part. Whereas the father,
you know what? I think my husband would disagree with you there. To be honest, I agree with you because I see it in my children. At the end of the day, when they're tired, when they've had a bad day or whatever, it's always mama. They come back. They want me. Or when they're sick, or yes, I agree with you, and I think that is also a biological part of it. But also, yes, we have a little bit more. I know what my kids are feeling, and I can kind of. Whereas my husband perhaps might not get it quite then and there, but
Is that what he would disagree on? He
would.
He thinks
he's a wonderful father. He is completely dedicated to his children, and he loves spending time with them. And I think that's part of the reason why it's almost, it's close to a 50-50 split between our time spent with the kids. He works very hard. He works 6 days a week. But when we have time off, he's extremely hands-on. And he loves to spend time with his children. He loves to, give them that emotional support that I can give also. So, I think it depends on the couple, to be honest, and the family relationship. But yeah, absolutely. I think mums can't be replaced. But again, I think fathers can't be replaced either. So, I don't think there's a rule in that sense.
We spoke about the impact of, we're speaking about mothers, so that's what this came to my mind.
Yeah.
We spoke about the role and the impact of your father as a dentist on you, and the fact that you're a dentist for 8 years now, and you're working with him, and he's a lovely man.
Yes.
He used to, I remember when we were kids and we'd go to these caravan trips, he used to do small talks for the kids and even the youth, the elders.
Yeah.
And he's very well spoken. So he's had an impact on a lot of Iraqis.
That's really nice
in the community. But I always feel it's important now that we've mentioned your father to also mention your mother. You know,
100%.
the you know, especially the fact that Islam and the Prophet himself gave. There's so many nice sayings and traditions and about the mother and her role and what's the role of your mother?
She has
on
been
you?
such a role model for us. She is literally the reason why, especially I speak, when I say us, I say my sister, but also I'm sure it's the same for my brother.
Mm-hmm.
She is so strong and she's so, she's supported my father and now she supports us so much. It's without her, none of this would have been possible. And I know that sounds like a cliche, but it really, truly is the reality of it. She was always there for us. She chose not to work. She chose not to study, which is actually really interesting, that we now are not like that.
Yeah, so
but again, we also saw the effect that it had on her. You know, she wished at that point that she did have something else to do.
But it's nice that you mentioned she chose.
She chose.
She
chose, and that was a choice that she made, but it wasn't an easy choice.
And it was a big sacrifice.
It was a big sacrifice for her because she's an extremely intelligent woman. Now that we're older, she has her own jewelry business.
Nice.
Which I like to advertise.
Okay.
No, I'm joking. No, she's an amazing jewelry designer and she studied for an MBA as well. So she's...
very good.
You know, she did come back to concentrating on herself and her own career afterwards. But I think all those years... what she was feeling in those years was perhaps she wasn't reaching her maximum potential. But we appreciated it as children, 100%.
Yeah.
But I don't know, the honest answer is I don't know if it would have affected us if she'd gone to work or not. You know, I think that we would have been fine, probably. But I can't say that because we didn't live through it. So, and
I think it's different with that sort of generation of Iraqis. I'm speaking as an Iraqi as well to sort of the newer generation, and especially now. I think when you're married, most of the times both the couple need to work.
I mean financially, yes, I agree.
That's the first thing, and secondly, I always say that. You need every human being is unique and has a potential and has dreams and ambitions and aims in life. And I don't think it should be for anyone to stop that. And the worst part is if you stop it yourself. And I'm talking generally about a lot of men and mostly women who think that, oh, maybe I shouldn't do this course, or maybe I shouldn't work, or maybe I shouldn't pursue this because I'm a mother. But mashallah, in our community we have many women who are both wives, mothers, and they're working and they're in great professions, and they've proved that they can balance that. You mentioned that. I don't know if I've got the right balance, but mashallah, you're doing it.
Alhamdulillah. I think it is it's about, I think if whatever you want, you can achieve it. It's just about how you're going to do it. And you need to have a system, and you need to be organized, and you need to, I always say, write everything that you want down and then see how it can be achieved. And does it all fit together as well? If something needs to be sacrificed, that's fine. Put it on hold and then come back to it in the future. I think it's, it can be achieved. It just might be a little bit more difficult, but that's okay. Difficulty puts us in, it makes us grow. And I think that's really important. And the need for this in dentistry, it specifically has allowed me and my sister to actually set up a support group for this.
Okay.
We've done that for women, not Muslim women, not Iraqi women, all women in dentistry.
I was going to ask if you have some advice. Now you mentioned this.
Yeah, well, that's the thing. So if you want to achieve something, but you feel like you can't because you're a woman, for whatever reason, you have children, you have to balance all sorts of things and whatever, we want to set up a sort of a group where we can help each other, get closer to our goals, because it bothers me that if a man sets a goal, he's able to achieve it relatively easily, but a woman, it's more difficult. So why can't we help each other? And we're not in competition with each other. I don't believe there is such a thing as competition.
Between men and women, you mean?
Between men and women, no, but also between women and women.
Women, okay.
People say, oh, why are you helping other dentists? Well, what do you mean? We're all in the profession together. We need to support each other. We need to help each other. Otherwise, everybody's just isolated in their own, little bubble. And you can feel alone and you can feel inadequate, especially with social media. So let's all come together, pool our ideas, pool our energy, and hopefully try and achieve something better for ourselves.
This support group, how do people reach out to you?
So we've had one meeting so far, but we're planning
nice.
another one very soon. It started off very small, but we've had so much interest. People have literally been messaging us left, right, and centre, being like, I want to be involved. I want to know. So we came together as a group of about 20 women, not only dentists, we had some technicians and some other people from the business. And we talked about basically all of the challenges that we're facing. And we have all different experience levels. We've got, practice owners, and we've got people who've just graduated. And it's really nice to be able to, because, for example, a new graduate knows all about social media. They grew up in social media. So they can help somebody who is, a practice owner.
Been
and
there
then
for 30
exactly,
years.
and then vice versa. And we're interested in things like nutrition and mental health and, how to achieve that balance. And also we are, as women, underrepresented in a lot of official dental bodies. So, for example, all of our associations, Cosmetic Dentistry, all of these. So it would be nice to be able to, have women in those positions to be able to represent us properly.
Well, Dr. Safa, thank you very much for joining us today.
Thank you so much.
I've enjoyed this chat. I hope everyone has sort of benefited and taken something from it. And we wish you and your family all the best. Thank you
so much. Thank you.